I'm Dr. Nikhil Hegde.
We are both consultant orthopedic surgeons at Rashtrotthana Hospital, Bangalore. We completed our master's degree in orthopedics from Kasturba Medical College, Manipal, and since then we have had extensive higher training in musculoskeletal injuries and sports injuries in dedicated specialty units and also a fellowship in arthroplasty. Rashtrotthana Hospital is a 162-bedded integrated center with state-of-the-art facilities and infrastructure. Our department of orthopedics, is well equipped to handle a wide variety of cases, offering both surgical as well as non-surgical treatment. We are ably backed by state-of-the-art ICU and a modular theatre. Our theatre is capable of handling various types of surgeries, including trauma, arthroplasty, spine, as well as arthroscopic surgeries.
Today, we would like to talk to you all about one of the most common complaints that a patient comes to an orthopedic clinic with, and that is knee pain. So, there are a wide variety of causes that may be contributing to your knee pain, and these causes vary depending on the age, depending on if there is a prior history of injury, depending on if there are other comorbidities. So, at our center, what we look to do is when a patient comes in to do a comprehensive checkup and try to come to an expert diagnosis. And based on this diagnosis, either using any sort of testing modalities or by just clinical examination, then we plan our treatment, which will be specific to individual causes. So today we would just like to speak about some of the more common causes of knee pain that may be affecting either you or some of your family members. So there are many varied causes. It can be either because of trauma, because of tumor, infection, degenerative causes such as arthritis, following sports injuries, which is very common in the younger age group, and sometimes just some sort of vague, non-specific knee pains which may come and fit into one of these broader categories. Now, one of the most common causes in individuals generally past the age of 50 to 60 is arthritis. Now, arthritis is not a disease per se, but it is more a condition that happens because of repeated loading and strain on the knee. It is because of wear and tear where the cartilage, which is the cushion surface between the two bones, tend to wear out and causes pain in and around the joint. So usually what happens is the patient has pain on bending the knee, on climbing stairs, and day-to-day activities start to get hampered. So based on an examination and then an X-ray, we grade arthritis on 4 grades, from very mild to severe. And for each individual grade, there is a different type of treatment required. In the early stages, it is purely exercise-based and a few lifestyle changes to prevent the loading on the knee. Further on, we start with some medications and physiotherapy. In our center, we have the advantage of the Ayurvedic treatment also, which we can give in the earlier stages of arthritis to help prevent the progression of the disease. Sometimes we may not be able to stop it entirely. At the later stages, along with medication, there are options where we give an injection into the knee joint to help reduce the symptoms and then continue the exercises. And in the last stage of the disease, once we have exhausted all of the options, they require a total knee replacement. There are other surgical options before the total knee replacement, but in the total knee, what we do is the part of the bone that is damaged, that is replaced with a prosthesis. Another very common injury is sports injuries. This can affect anyone from a child or a very young person to across the board. And sports injuries may not happen classically just for active sports. Even when you have a small slip and fall or a twist in the knee, you can present with a sports injury. When we talk about sports injuries, usually it is in terms of ligament tears or meniscal tears. Now, one of the most common sports injuries when they tear the cruciate ligaments, either the anterior cruciate or the posterior cruciate. Again, when a patient comes in, usually the symptoms are knee pain following a history of an injury. There may be swelling in the knee. Very classically, there is instability. When the patient walks, they suddenly feel there's a feeling of giving way. They may fall, or just pain on regular activity. So again, what we do is clinical examination and then investigate. And in case there is a tear, Again, it depends on how bad the tear is. If it's a partial tear, again, it's just physiotherapy, medication, and slow rehabilitation back to return to active normal life. And in a complete tear, if there is a gross instability, then the patient requires surgery. In such cases, here what we do is we do a keyhole surgery, but there is no big incision. So with a small, just 1 centimeter incision, you go in and you replace or either repair or you replace the torn ligaments. Another common injury is the meniscal injury. So now this can happen while playing sports, or sometimes in slightly elderly individuals, it can happen just by general twisting of the knee. They may experience pain on suddenly getting up from a sitting position, on attempting to squat or sit cross-legged. These may be painful. There may also be the hearing of a clicking sound in the knee, or sometimes the knee may tend to lock in one position. So in any of these, if you are experiencing any of these symptoms, then you may have a meniscal tear. Again, the treatment depends on the severity and the stage of which you presented the condition.
Another important cause for knee pain is the presence of inflammatory arthritis. Inflammatory arthritis commonly includes rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, reactive arthritis, and gout. These conditions are characterized typically by the presence of morning stiffness, which gets better as the day progresses. Depending on the condition, other joints may be involved too. It is important to pick up these conditions at an early stage so that the late complications of these conditions do not set in. There are various non-invasive treatments for these conditions in the early stages, but of course, if the condition worsens and complications do set in, then they may end up needing surgical interventions. Another important condition is the presence of infection in the knee joint. This is termed as septic arthritis. This is one of the few orthopedic emergencies which need immediate surgical intervention, or else irreversible damage to the joint may happen, and further the infections can spread to other parts of the body, threatening life.
One of the other conditions, which is fairly rare but is very important condition, is the presence of a tumor. The tumors around the knee again can happen at any age group, and usually when they happen, if it is a cancerous tumor, it can be a non-cancerous tumor also, but in a cancerous tumor there are usually another group of symptoms that happen that accompany the tumor. One is, of course, there may be some amount of swelling in the knee, there may be pain in the knee, there may be progression of the size of that swelling may grow quite fast. There may be associated loss of appetite, loss of weight, body weight. So at any point, if there are these group of conditions all happening together associated with the knee pain, then it should be tested for the presence of tumors. At our hospital, we are associated also with a team of oncology surgeons who come here, who have an expert and numerous years of experience in managing both orthopedic tumors and general tumors as well.
Just to summarize, knee pain is common across all ages. The treatment of knee pain depends on its diagnosis. Most often, the treatment is simple. It includes a routine exercise regime and certain lifestyle modifications.
The key in all of these is to pick the conditions up early so that the chances of permanent damages are very minimal. Thank you.
Thank you.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.